Hello, everyone. Welcome back. I'm Robin Anderson, Director of Programs and Communications at the Canadian Agricultural Safety Association, and I'm so glad that you've joined us this afternoon to hear from Jessie Adams, Associate Research Fellow at the National Centre for Farmer Health in Australia. First, a couple housekeeping items. We'd like to thank our conference sponsor, John Deere Canada. It is thanks to them that we were able to offer registrations free this week. So thank you so much to them, and thank you so much for taking advantage of them. If anyone, you know of anyone that would like to come to any of the conference uh, panels this week, please forward them on the link, and we are accepting registrations right to the end. Microphones and cameras are disabled, and if you have any questions, please use the Q&A feature at the bottom of your screen. We'll monitor these questions, and we will share them during the Q&A time. Closed captioning is available for the conference in 20 languages. This is located by clicking the closed caption button at the control bar at the bottom of the screen. Click it to turn on captions and select the language when prompted. All presentations will be recorded and shared to all registered delegates following the conference. And if you require any of the conference materials translated, please contact Megan Truxell here at CASA. So Jessie is here today to share her insights on child farm safety through an Australian lens. Jessie Adams is an Associate Research Fellow at the National Centre for Farmer Health in rural Victoria, Australia. Growing up on her family's beef farm in Northeast Victoria inspired her passion for improving the health, well-being, and safety of farming families and communities. Throughout her time at the center, Jessie has worked on numerous projects aimed at improving the lives of farmers, their families, and communities. Jessie recently completed her PhD focusing on exploring the injury risk and safety behaviors of children on farms. Jessie was awarded a Churchill Fellowship, which took her to the United States, Canada, and Ireland in mid-2025 to investigate approaches being adopted internationally to improve child farm safety and education. Jessie is committed to translating the learnings from this into practical strategies to reduce keeping children safe on Australian farms. I was really lucky enough to spend some time with Jessie this last June, attending a safety day here in Saskatchewan and getting to know her. I am so excited that she's able to be here with us today to share her insights. It's very early in the morning for her, so thank you, Jessie, for making all the preparations and agreeing to come on at essentially 5 in the morning, I believe, your time. So thank you so much, and I'm going to actually turn it over to you to start the presentation. So welcome, Jessie, and thanks everybody for attending. And if you have questions, please pop them in the Q&A bar, and we'll get to them when we get to our Q&A session. So thank you so much.
Thank you so much, Robin. Thank you for having me. I will just share my screen. So thank you very much for having me. Yes, it's 5 a.m. here in the morning, so my brain's not at its best, but we will see how we go. And thank you, Robin. Yes, I did have the pleasure of meeting Robin in Canada when I visited in June, and we had a great few days. So thank you for having me here today. So before diving in to talking about child farm safety, I thought I would give you a little background about where I'm from and what I do. So I'm a researcher at the National Centre for Farmer Health in Australia, and we're based in the agricultural town of Hamilton in southwest Victoria. We have a population of about 10,000 people, and as you can see on the map, we're right down the bottom of the country. The lovely sunshine weather that everyone associates Australia with is up in the northern states. And the picture of the landscape shows the Grampians area, which is a region that we're based in. So that's our landscape and is popular for hiking and tourism. The National Centre for Farmer Health is a partnership between Deakin University and Western District Health Service, which is our local health service here in Hamilton. And that's a picture of our office here in town. The centre was established in 2008 with the program Sustainable Farm Families, which combined health checks with education for farmers and their families. Since then, the centre's grown quite a lot and we have a lot of new programs, but our mission remains the same: to improve the health, well-being and safety of farmers, their families and rural communities. And we do this through service delivery, research and education. So over my 7 years at the centre, I've been lucky enough to work on many projects in all the areas of health, wellbeing and safety. But my more recent focus and what I've completed my PhD on is child farm safety. So the first part of my talk today, I'm going to share some results of that work. So the risks, behaviours and safety strategies of children on farms in Australia. And as I share some of the findings, I think you'll see some similar themes and challenges of what you experience in Canada as well. So I thought I'd just start with some quick stats on farming in Australia to help paint the picture of what's happening down here. Farming in Australia utilises 55% of our land. So this map on the side just shows the land use and the different types of farming. The middle of Australia, where it's sort of white, is desert and there's not much happening there. So agriculture is big in Australia. Agriculture employs around 368,000 people, which is just under 6% of our rural employment. Common farming types is grains, so that's largely cereal grains, livestock, so sheep and cattle, and dairy and horticulture. Australian agriculture provides more than 90% of our domestic food, and we export about 70% of agricultural production, and it contributes 2.4% to our GDP. And to continue setting the scene, this slide's just to show you what's happening in terms of our farm injury fatalities in Australia. We have two main sources of farm injury data. So the first is Safe Work Australia. That's a government agency that reports on all worker and bystander fatalities in a workplace setting. And then we have Ag Health Australia and AgriFutures, who work together to produce an annual report on both the fatal and non-fatal injuries on Australian farms, and they do this from media monitoring. So the media monitoring approach is particularly valuable because it's not all farm deaths are obviously classified as workplace fatalities. So this means they're able to capture a more complete picture of what's happening. So on your screen, this is one of their graphs, and it's just showing the farm fatalities in 2004, which is the red bars, and then comparing it to 2024 and 2023 as the grey bars. So in 2023, there were 32 deaths recorded by Ag Health. And if we're comparing that to Safe Work, there was 27, so slightly different numbers. But what is most striking is the huge increase in 2024 with 72 farm deaths, which is almost double our 5-year average. So this is just showing us that while we do see years of improvement, the overall trend is not consistent, and years like 2024 highlight the ongoing challenges and need for improvements in farm safety. Now focusing more on children and child farm injuries in Australia. So since 2001, 1,815 Australians have lost their lives on Australian farms, and this is to the end of 2024. And of these, 248 were children under 15, and that represents about 14%, which has been a really consistent rate over a long period of time. When it comes to non-fatal injury, the picture is less clear as our hospital system does not allow us to easily collate farm injury-related and hospitalisation data. The media monitoring reports do provide some insights, and that's obviously more serious injuries, though these are largely underestimated as we know that injuries don't always make the media. So that is what this second graph is here. You can see that in 2024, there were 20 children seriously injured on farms, and this represented about 15% of injuries overall. Some additional data sources give us some further context. The Australian Institute of Health and Welfare reported that between 2010 and 2011 and 2014 and 2015, that's our most recent data we can get from them, around 2,000 children presented to hospital with farm-related injuries. And then KidSafe Victoria, which is the state that I am based in, estimated that in 2020, 2021, 441 children were hospitalised in the state due to farm injuries, which is about 8 children a week and was a 12% increase on the previous year. We also know the key hazards responsible for child fatalities. A study that covered 2001 to 2019 using the media monitoring found that 75% of child farm deaths were due to the key hazards that you can see on the right-hand side of your slide. So water bodies, quad bikes, or four-wheelers, I'm not sure what you call them. Tractors, utes and cars, motorbikes, and horses. And these continue to be the leading hazards today. Aside from in 2024, we also saw a huge increase in side-by-side deaths, which is when you're next to each other. I also don't know what you call them. With 3 children dying from these in 2024, and these have, as of this year, become the leading cause of death overall on Australian farms. So there are over 87,000 farming families in Australia, and nearly half of these have children living on the farm with them. So children are always going to be present on our farms, and we know it's part of the lifestyle. As you can see, I was one of those children growing up on my family's beef farm. I loved it. I spent my days playing in the paddocks, waiting for work to be done. And then when I was getting a bit older, I started to do farm work. As you can see down on the bottom, that's me on my horse getting ready to go and move some cows. At the time, I had no idea that farms were actually the most dangerous workplaces in Australia. So we know that injuries continue to occur, and we are aware of the main hazards responsible. And this led to the question, what is actually happening on farms? What are children doing on the work site? And what are the hazards that they're regularly engaging in and the safety measures that are being used to try and keep them safe? Answering this question was the focus of my PhD. So I used a Delphi method where a panel of experts assisted in developing surveys for both parents and children to investigate their exposure to farming hazards, risk-taking behaviours, work on the farm, and use of safety measures. And we thought it was important to get perspectives from both the parents and the children. The focus was children aged 5 to 14 years to align with our data collection methods here in Australia of looking at children under 15 on farms. And the goal was to collect evidence to help guide practical prevention initiatives so children can enjoy growing up on farms while staying safe. So in total, we had 107 parents and then 62 of their children complete their respective surveys. During data analysis, we broke the results into younger children, so 5 to 9, and older children, 10 to 14, just due to the large difference in development during that time. And now just touch on the key themes that came out of the surveys. So firstly, not a surprise, but there's a blurred distinction between the farm as a home and a work site. Almost all parents, so 99%, reported their child was allowed on the farm work site, and over 80% take their children with them while they perform farm work. So this shows that a farm is not just a workplace, but it's a child's home and playground, a place where they are cared for while work is being done. The graph here shows factors that influence how much time children spend on the farm work site, and unsurprisingly, school holidays and seasonal work demands were major influences. We also see differences by age. So older children, the 10 to 14 years, were more likely to be on the farm because their parents needed their labour. And younger children, 5 to 9, were more likely to be there due to there being a lack of childcare. So this indicates a shift over time where children move from being on the farm for the primary purpose of care to participating and contributing to farm work. So we need to do further research to understand when this transition exactly occurs and how parents determine their child's capabilities of these different tasks. The second key finding is that children are regularly exposed to the main hazards responsible for farm injuries, which is the ones I mentioned earlier. And also, I guess it's not a surprise, as it probably explains some of the data. However, vehicles like tractors and quad bikes are not recommended for children to be engaging in at all, but they continue to. So our survey showed particularly high vehicle use and driving mainly around with older children, and they were doing this for completing work. And the aged children were starting to operate vehicles appeared to be getting younger. So I'll just touch on one of the key hazards as it's the most controversial in Australia. So quad bikes, children under 16 in Australia are widely advised not to ride or operate them. Yet in our survey, over 50% of children rode as passengers and over 30% operated quad bikes. So of those operating them, 38% carried passengers and 90% were using adult-sized quad bikes. Adding to the danger was that safety measures were limited. So supervision was the most common safety measure in place, reported by the parents. But 65% of children in their survey responded that they operate the quad bike without parental supervision. Only 43% of bikes had operator protection devices, and that's the safety bars at the back to prevent rollover. Since late 2021, these are now mandatory on all new bikes sold in Australia, and there was also rebates to retrofit them as well. And finally, only half wore helmets while on the quad bike. So these results highlight the urgent need to understand why children continue to use quad bikes and also with minimal safety precautions despite the well-known risks. The third finding is that children are routinely relied on for farm work, which is deeply embedded in the family farm lifestyle. We knew this anecdotally, but our survey is now confirmed. So 94% of children perform farm work, and 90% of these are starting before they're 10. Children were spending mainly around 6 hours per week on the farm, but there was busy periods that they said they did more. The most common tasks were all animal related. So this included checking livestock, working with large animals, feeding baby animals, and mustering. Younger children were mainly feeding baby animals. Parents reported assigning tasks because their children enjoy the work. It provides time for family bonding. They needed their help, and half selected it because they chose the tasks based on what they did at the same age. So this demonstrates the intergenerational nature of farm work and may partly explain why injury rates are not improving as behaviours are remaining unchanged. Concerningly, only 2% of parents reported considering legal requirements of the farm as a work site when deciding tasks, and it's unclear if this reflects a lack of awareness that it is a work site and there are considerations or cultural attitudes towards workplace regulations. And then children reported they engaged in farm work because they enjoyed it, their parents wanted their help, and they enjoy spending time with their family. Older children were significantly more likely to be relied on for their labour, showing the role children play in sustaining family farming and contributing to the broader agricultural industry. So farming is clearly more than an occupation, it's a way of life that's passed down through generations. And then following on is the next one is on safety measures. So parents primarily rely on rules and supervision to keep children safe. Both of these are administrative controls on the hierarchy of control, which is the image on the top. So they're considered less reliable than engineering and elimination strategies, largely because they rely on human behaviour. So as expected, parents of younger children were significantly more likely to supervise their children than parents of older children. Also, interestingly, we found that 71% of children that had younger siblings reported that they look after them on the farm. Other basic safety measures were inconsistently applied. For example, less than half of parents made seatbelts compulsory in vehicles. Parents identified barriers to implementing safety measures. So this included a lack of awareness of what to implement, traditions, influence of others, cost and time. And parents of younger children were significantly more likely to feel like there was insufficient resources or education available to help them make decisions to keep their children safe. The final one is that knowledge and safety culture is passed down through generations. So nearly 90% of parents reported that they see themselves as role models for risk and safety behaviours on the farm. And this was particularly important for parents of younger children, while parents of older children feel like they may have less influence now over their children. However, there was 36% of parents that did acknowledge that they do behaviours that they do not want their child to copy, such as rushing, impatience, working at heights, or not using personal protective equipment properly. And interestingly, these same behaviours were often what parents used to say that they purposely did as positive role modelling. So this is potentially demonstrating cognitive dissonance, where there's a gap between beliefs and actions. A fatalistic culture was emerging, with 30% of children believing being safe on the farm didn't guarantee they wouldn't get hurt. This was higher in the older children and perhaps reflecting the type of activities they're engaging in and their more developed attitudes. Despite this, children were generally aware of risks, with 90% recognizing they could get hurt using quad bikes, tractors, motorbikes, or horses. So this finding highlights the importance of addressing both parent behaviours and children's risk perception to strengthen farm safety across generations. So the results of my research highlighted there is a need for change in some farm safety behaviours and attitudes in Australian farming. And achieving this requires a cultural shift, which we know is a very long-term goal rather than something that will be happening overnight. To support this change, we recognise there's an importance of a whole-of-system approach where all stakeholders play a role, and farm safety education involves the whole family. This thinking led me to apply for a Winston Churchill Fellowship, which I was fortunate enough to receive in late 2024. So the fellowship allowed me to spend 6 weeks travelling to Ireland, Canada, and the United States to investigate how other countries are addressing child farm safety. And the goal was to learn from these other countries and explore what we could then apply in Australia. So this slide's just showing the countries I travelled to and the places that I visited in each country during my fellowship. So I left Australia and headed to Ireland and then Canada and the US over the 6 weeks. So I thought I'd briefly touch on the organisations and places I was fortunate enough to visit, which will be a whirlwind, and then finish with the key learnings that I have brought back here. So the aim is to hopefully inform future efforts in Australia, but perhaps there's something that can also help you guys. So my first stop was Agri-Kids in Ireland with Elma Jordan, where I observed her school-based program and learning about the broader farm safety initiatives they have. During the visit, I observed interactive sessions at both a new school to the program and a returning school. Elma used storytelling, visuals, and hands-on activities and age-appropriate content to engage students and teach key safety topics such as machinery, animals, slurry, which isn't a thing in Australia, and quad bike safety. Students received certificates, and schools could also participate in their Farm Safety Ambassador program to reinforce learning and pride in safety and hang up the things in the top picture. Agri-Kids also has a van which brings interactive safety activities to community events. And they also have the Engage, Educate and Empower training manual, which supports and helps inform the delivery of programs to promote farm safety by teachers, farmers and community members. I then met with David, Meredith and John McNamara from CASA, where we discussed that children on farms face increased risks and that the safety culture, farm design, practical training, clear communication and locally relative initiatives, such as communities of practice and farm advisor programs that they have, are key to improving child farm safety while supporting broader farmer wellbeing. My last stop in Ireland was with Embrace Farm, who work at the other end of the spectrum. They're a charity supporting families affected by serious farm incidents. And they highlighted the importance of providing trauma-informed, emotional and practical support peer-led recovery, and ongoing family-focused engagements to help farming families navigate loss and adapt to life after a farm injury or a fatality. Next, I was off to Canada, where I was lucky enough to visit 3 organisations, and you might be familiar with these ones, so I won't go into them too much. But I visited Heartland Training and Support Hub, CASA, with Robin, and the Canadian Centre for Rural and Agricultural Health. During all these visits, I was able to observe their unique child farm safety programs, and all were slightly different. Heartland, I visited in Raymond, Alberta, and observed their flagship school-based Safety Smarts program, which delivers interactive farm safety education to rural children across Alberta. During the visit, I attended sessions at a Hutterite colony and at a public school. So noted how instructors adapt content to different age groups, cultural contexts, and school settings. And the program used hands-on activities, storytelling, and take-home resources to engage students and then involve their families. CASA, I went with Robin to a Progressive Agricultural Safety Day in Weyburn, which was a volunteer-led community-based event for children that provided hands-on interactive farm safety education. So the students rotated through multiple stations, covering farm hazards such as machinery, grains, animals, chemicals, sun safety, and first aid. So the program is locally tailored to community needs and included take-home resources to encourage further learning. And it highlighted to me the value of combining national coordination with grassroots delivery to engage children and build a culture of farm safety in the community. The last stop in Canada was the Canadian Centre for Rural and Agricultural Health in Saskatoon, and they run the Agricultural Health and Safety Network. So this was established in 1988, and the network is a voluntary membership program for rural municipalities. Member RMs gain access to services including school-based discovery days, farmer health checks, workshops, newsletters, and research updates. So the discovery days, which I got to watch, are delivered to children in grades 4 to 6 in an interactive 1 hour or 40-minute session using storytelling, props, hands-on demonstrations, and real-life examples. So their topics included grain safety, 4-wheel bikes, electrical hazards, sun safety, ROPS, helmets, use of helmets, and then a farm safety hazard board. And each child again received a take-home package to engage their families. Finally, in the US, I went to the National Children's Center for Rural and Agricultural Health and Safety in Wisconsin, where I learned about all their work in research, practical interventions, capacity building, and sharing prevention information with families and their communities, along with eating a lot of cheese. Some of the key initiatives I observed was their youth work guidelines, which helps adults assign age-appropriate farm tasks by assessing their skills and ensuring safe supervision and use of personal protective equipment. The Cultivate Safety website, so it provided lots of interactive resources for children and parents to stay safe on the farm. The Ag Injury News, which was a searchable database of agricultural injuries and fatalities in the US and Canada through media articles. Their focus on communication and messaging. So they have an emphasis on authentic, relatable messaging from people with farm experience, focusing on brand journalism, media partnerships, and innovative approaches like updating Wikipedia pages. They're also currently focusing on trying to shift the language from accident to incident to promote a prevention mindset in child farm fatalities. And then campaigns and storytelling that aim to influence attitudes and priorities around child farm safety. During my visit, challenges discussed included balancing agricultural tradition with safety, the childcare gaps in rural areas, which we have a lot of here, reaching underrepresented groups and integrating safety into youth programs and existing programs that are happening. So I thought I'd go over some of the key findings that I learned or observed during my fellowship and what I'm hoping that will be useful in Australia as we try and work out what our next steps will be here. So during the fellowship, I was lucky enough to observe a variety of child farm safety education programs. They were all unique, but highlighted the need to make sure they're engaging, age appropriate, and continuous messaging. So some of the key points was introduce education earlier. So the earlier we start talking about farm safety, the more likely those messages will become lifelong habits. It's about giving children a sense of agency, helping them understand they have a role in keeping themselves and others safe. At the moment at our centre, we largely focus on late high school and agricultural studies post-school for farm safety. Use of interactive methods. So children learn best through doing, not just listening. So activities like games, songs, and the hands-on demonstrations make safety lessons memorable and fun. And we need to make sure the content is obviously always developmentally appropriate. Target all children. Safety messages shouldn't just reach farm kids. We need to include visitors, friends, and relatives who may not understand farm risks. 1/3 of all child farm deaths in Australia are visitors, so these are a vulnerable group. Collaborate with others. Schools, community groups, and agricultural organisations are key partners. Working together helps reinforce consistent messaging across different settings that people are in. And then again, repeat the key messages and evaluate impact. So it's important to check what is working. So a simple evaluation helps to refine programs and show that they are being effective. Family involvement is crucial. So providing take-home resources encourages families to continue the conversation and apply the messages on their own farms. And it also helps bridge what's been learnt in the classroom with behaviour change at home. And finally, adaptability is essential. So programs should be tailored to suit the child's age, prior knowledge, and the school context. And facilitators sharing their personal stories or local examples, so adding their own touch, makes the learning relatable and meaningful. Secondly, building a strong community-wide safety culture is key to sustaining long-term change. It's not just about the individual program, but about creating shared responsibility across the whole community. So engage local trusted voices. People in farming communities often listen to those they know and respect. So by involving local champions such as farmers, teachers, health professionals, or community leaders, we can help set meaningful safety priorities and ensure the messages really resonate. Promote shared responsibility. So farm safety isn't the role of one organisation. When everyone sees themselves as part of the solution, from families to schools to industries, the impact is greater, and peer influence can be a powerful driver for change. We need to strengthen partnerships, so collaboration across all these different groups I've mentioned helps align efforts and make use of existing networks. It ensures consistent messaging and reduces the risk of conflicting information. Share resources and co-design programs. So working together to pool expertise and adapt materials for local relevance and co-designing with the end users, make sure it's more practical and engaging. And working together avoids duplication and enhances reach. A key element in sustaining impact is ensuring long-term reliable funding, which is a big challenge, I think, everywhere. So this is, I guess, a dream, but we need to secure sustainable investment so programs can continue beyond short-term grants or pilot phases. And this consistency allows messages to be reinforced and embedded over time. It's important to engage the agricultural industry and related organisations as active partners, not just funders. When they're involved in program design and delivery, there's greater ownership and alignment with the industry priorities. We should advocate for national prioritisation of child farm safety. A key strategy is to communicate the shared benefits. So improving safety protects children and families, but it also strengthens the industry's reputation, reduces workplace risk, and supports a sustainable rural workforce. And finally, funding should support evaluation and continuous improvement. So the ongoing monitoring helps demonstrate effectiveness and justifies the investment and guides how to adapt programs. Effective communication is obviously essential in making the farm safety messages stick. So using relatable messengers like farmers, teachers, community leaders, people that are trusted and the community can connect with. Storytelling, visuals, and real life examples make messages memorable and emotionally engaging, particularly for children. And using a multi-channel approach, so combining social media, radio, newspapers, and school programs to reach different audiences. And I think also something we need to do here is research how our target audience prefers to receive information so that they're delivered in the most effective way. Embedding child farm safety into broader systems ensures lasting change. And there are some more long-term things, I guess policy advocacy is quite a long-term goal, but integrate safety education into school curriculum so that all children get to learn the skills early, secure the funding models that I described before, strengthen regulation and enforcement of farm and workplace rules that we have. Align policies across education, health, and agriculture so efforts are coordinated and consistent. And finally, regularly review these policies and monitor injury data to track progress and guide future action. And finally, evaluation ensures programs are effective and continuously improving. And I think this is an area that we could all work on. Monitoring reach, uptake, and impact to understand how programs are performing, maybe using pre and post surveys and other metrics to measure learning and behaviour change, and then adapt programs based on feedback to make sure they're relevant and engaging. Making sure that initiatives and programs are relevant and up to date, so track injury trends to guide priorities, and build a strong evidence base to support sustainability, funding, and advocacy efforts. So to summarise, effective child farm safety relies on early education, increasing child agency and empowering children as safety ambassadors. Teaching must be creative, interactive, relevant, and story-based, and programs should actively involve their families as well. They need to be adaptable to meet community needs and supported by strong collaboration. So both within organisations to align messages and share resources, and across the community to leverage existing relationships and new ones for reach and consistency. So we need sustainable funding. So investigating corporate investment options to support prevention and assist clients to keep safe could be an option. Communication should be clear, consistent, and use correct language, and maybe work with media where appropriate. Policy advocacy is vital, so the goal of embedding farm safety into the curriculum and expanding funding opportunities. And finally, evaluation and ongoing research to ensure that programs remain relevant, evidence-based, effective, and continuously improved. So thank you so much for having me. And come and visit us in Australia if you would like.
That was wonderful, Jessie. Thank you so much. It's really cool to see how your travels and your observations have come together to have such a strong and interesting findings. So I appreciate you taking the time to go over those with us. I think that's really, really interesting and really great to hear about what you found out and how we can action those findings in our own organizations. We do have a few questions. So I think the first one is mostly a question about maybe what side by sides is side by side primarily on ATVs. I think you were talking about like there's side by sides and then there are ATVs or quad bikes, right? Like we have both of those up here in Canada as well. Um,
Yes, yes.
right?
Sorry, I don't know the exact terms of what you guys call them, so it gets a bit confusing. But yeah, so we have the quad bikes. I think they're four-wheel bikes, that you call them, and then we have the side by side. So that's more the buggy style where you are sitting side by side, and there's normally a seatbelt
Yes,
and a
yeah,
tray
that's
at the back.
exactly. Yeah, we quad bike ATV, that's synonymous here. And then we also have side by sides or in French côte à côte, which is I think a great name for a side by side.
Oh.
So Jim is asking about roll bars on ATVs, and this might be out of scope, and that's okay if you don't know this answer, and we can refer Jim elsewhere. But are bars common on ATVs, and what are current practices regarding them?
Yeah, yeah. So I briefly touched on that. So they roll bars became mandatory on all new quad bikes sold in Australia, and that was in late 2021. So any bike that you buy, any quad bike, four-wheel bike that you buy now has to have rollover protection on it. And then we also had rebates to for farmers to get the roll bars retrofitted onto their quad bikes, which wasn't compulsory. So there definitely is lots of people that don't have them. As I said, only 40% of the children that were operating quad bikes did have rollover protection on their bike. But yes, they're compulsory from now on all new bikes.
Great, that's great. Thank you so much for answering that. Um, Good question here from Sandy. What commonalities did you see amongst the programs and countries you visited?
Yeah, well, I think I guess I touched on that. I think it was largely about them being so interactive and engaging with the students. It's sort of being a short time of around 40 minutes or so where it was just full on sort of for that whole time. Um, and some of the activities were similar. And adapting to the community, it was a big thing. And then obviously the topics, there was um, lots of similarities in terms of the key topics like machinery and farm hazards in general, but then each I guess country place had their unique hazards as well. So slurry in Ireland, which I'm not familiar with, and then ice safety in Canada is not a thing we have to think about here either. So just slightly different approaches, but they were all very similar. And I think it was really important, the person delivering the programs, I think, or in terms of the safety day, there was lots of different people, but the engaging nature of them, I think, was really key to the program being successful.
So I just for me following that up, were you surprised that like the approaches were so similar, even though, obviously, we are in different locations and we do have slightly different cultures, even though we are, primarily English speaking countries that you visited. Were you surprised to that you came across the kind of these similar approaches and philosophies when it came to kids safety and health on the farm?
I don't think it's that surprising. I think we're all similar in a lot of ways. And I guess farming is quite similar, children are similar. Um, it's just, I guess, yeah, different language or things like that might be different. But I think overall, yeah, they're the same. I haven't really thought about that, but yeah, I think there's lots of similarities between particularly, well, I didn't go to school programs in the US, but like between Ireland and Canada and Australia, I think we have a lot in common.
That really gladdens my heart. You know what I mean? Like we all really care about our kids and care about kids on the farm and care about our farm families. So I really like that. Everyone is so excited and so excited to be, sharing, that information with kids and seeing them get involved in safe, ways and practical ways. So that's really exciting. That's a really fun thing to hear, Jesse. Thank you. So Keith is asking, many Canadian farm communities include conservative or traditional communities that use very traditional structures in learning and decision making that mean educating and discussing issues with children need to be more traditional or structured. In your experience, are there best practices to be mindful of these communities to address those challenges?
Oh, that's a good question. Um, I mean, I haven't designed a program myself or worked in one here, as that's why I was traveling. So I don't have personal experience. I mean, in terms of observing programs, I guess I watched the difference in the Safety Smarts program between a Hutterite colony school and a public school. So how that content can be adapted to target different groups. And I think that's really important. I think making sure it's relevant to every community is needed. So I guess working out what the messaging is and what's appropriate within that community is really important. I know here we have a program for older children, actually Gear Up, which I think is also available in some places in Canada, but that uses like a pre-survey and then a post-survey. So the pre-survey here really informs what they're going to talk about when they go in. So maybe something like that is also helpful to know what level children are at before you go in, and what sort of things you should focus on as well can help make sure it's relevant. But I'm
Yeah,
not
and I
sure if
like
that.
how you mentioned like, having that, coordination between, maybe a large organization and then more, boots on the ground kind of community focused, because those communities often know, how to speak to their own community and bring that knowledge and learning and information to them. So yeah, that's really interesting. Thank you. Do you think this is from Emily, do you think there are differences in attitudes towards farm safety on multi-generational farms versus first generation, specifically child safety?
Oh, that's a good question. I would say this is very anecdotal. Um, we did in my survey, we did look at how long people had been on farms for, which was largely, they must have all been sort of multi-generational. Um, but I would say anecdotally, yes. If you're coming in, you're trying to sort of do the best that you can and the safest, and you don't have those traditions that you've learnt growing up. You haven't started um, out on your farm at 5 years old, picking up behaviors that sort of just become embedded, and you don't really second guess them. So yes, but I don't have any actual evidence to suggest that.
That sounds like a research project.
Mm. There
Mm.
definitely has been work in that space as well.
Um, there's another question here from Glenn. You mentioned measuring program effectiveness, which you also called learning. The ultimate measure is reduced incidence, but those are intermediate. There are intermediate measures. What are some examples of measuring effectiveness slash learning?
Yeah, well, I think it is a challenging thing to measure, because how do you really measure behavior change? So Glenn's right. It is largely injury statistics that we're wanting to reduce. But I think just in terms of probably those sort of post behaviors of implementing personal protective equipment, having conversations or changing little behaviors that you can capture in some way would be great. It's hard to capture attitudes as well, which is what we were trying to do in my survey as well. Um, but I think that would be good to work on more. Because I think farming communities know what's safe and what's not. It's just about sort of the tradition, and that you're used to doing what you're doing. In the work that I do, like in the community that I'm in, when I talk about, well, not that I talk about it that much, like in where I play sport in a local community team that takes up the whole community, they'll always be like, oh, you don't want to know what happens on our farm. So it's like there's awareness about it, but it's just about then changing that into the behaviors, which I guess we're all trying to achieve.
Yeah, isn't that interesting? And that is an interesting topic. I even on my own family, they'll say, "Oh, don't tell Auntie Robin," and it's like, "No, tell me. I want to know." I mean, if there's something that's not working, why are we doing it this way? Well, what are the
Mhm.
changes we can make? How can I make it how can I help make it easier for you to make the right choices? You know what I mean? Like, so I think having those conversations and, Caitlin this morning talked about, shame when it came to mental health. Well, there's also shame that can be associated with, physical health and dangers and things like that. And maybe
Mhm.
having those conversations and being like, oh yeah, we do these things and this is why. I don't think anybody sets out in the morning to go, oh gosh, today I'm going to get hurt on the farm. It's going to be, my kid's going to get hurt. Nobody, no, nobody says those or thinks those things. So, having those conversations and being open, I think is really important. And then, like you said, being able to try to measure, effectiveness of programming and can be really difficult, but we can just do the best with what we've got. So yeah, I appreciate that. We have a question here from Dan, and it's about injury fatality rates. Is there an
Mhm.
understanding of why the fatality rate increased so much? Do we know what those driving factors were?
No, actually, that's a good question. I don't know why they increased so much in 2024. Um, it had been quite steady before that for a while, and then 2024 was a lot higher, but there's nothing that really happened that yes, that should cause that. So yeah, I guess these things sort of happen over time and but yes, no, I don't have an answer for you, sorry.
No, that's okay. I think that's you don't need to know everything. That's all right. Thank you. Thank you for sharing, Jesse. We have a few more minutes if anybody has any more questions. Can pop them into the Q&A. We'd really like to, take advantage of Jesse being up so early, and sharing with us this morning. So, and this afternoon. So if you have any questions, please pop them in. I do also want to encourage everyone to attend tomorrow's session. We will be starting tomorrow at the same time we did this morning, at 11 Central's time. And we'll be back with a session on the Alberta Farmers Care Program and the Do More Ag Agricultural Foundation. That Zoom link that you got in your email, that's the same Zoom link for the rest of the sessions. So please use that to access the rest of the conference. So if we don't have any further questions, we can maybe let you go and start your day early. And we want to just say thank you so much once again, Jesse. You are a delight. A cool, laid back Australian with lots of interesting things to say is how I, if someone asked me how to describe you in one quick sentence, you've been just fantastic and great to meet you. And thank you so much for taking the time today and sharing your insights. And I really do hope we get to work together in the future. And yeah, so thank you everybody for today. It's been an awesome 2 sessions and really looking forward to the rest of the conference. So if you have questions, concerns, or if you'd like to share this conference with anyone else that you know of, please do so. And we would be really happy for you to join us and to have others join us as well. So with that, I'll say thank you and have a great afternoon, and we'll see you all tomorrow. Thank you again. Thanks, Jesse.
Thank you, Robin.